My name's Dan Leigey. I'm an orthopedic surgeon at Excela Health. The ACL is one of the four main stabilizing ligaments of the knee. It's also known as the anterior cruciate ligament. And an injury to the ACL can involve a sprain or stretching type of injury, or it can involve a tear. ACL injuries can occur in active patients of any age, and certain activities are more ACL dependent. So things that involve cutting, changes in direction, or jumping are ACL dependent type of activities. So sports like soccer, basketball, volleyball, they all can lead to ACL injury. But not all ACL injuries occur from athletic type of activity. Normal everyday things like missing a step going down the stairs or slipping in wet grass can cause an ACL tear. ACL injuries can typically be diagnosed by talking to the patient and evaluating their knee. So patients will commonly describe an incident with their knee where they feel a pop or they feel their knee move in an abnormal way. Typically it swells, and then shortly thereafter it feels unstable or they feel like they can't trust it. So when the patient's evaluated in the office, there's several tests that we can do to check the stability of the knee and get a feel for if their ACL is functioning appropriately. Imaging studies are used to then confirm the diagnosis. We usually get x-rays in the office to make sure there's no fracture or other bony abnormality. And then we do get an MRI to confirm that the ACL is torn, but also to rule out other structural damage in the knee like the meniscus or the articular cartilage. The treatment of an ACL injury is really catered to the individual patient. And younger patients or patients that want to get back to higher level athletic activity, especially those type of activities that involve a cutting aspect, usually require ACL reconstruction. That's a surgical procedure that involves replacing the torn ACL with a graft that functions like a new ACL. Not all patients with an ACL injury will require surgery though. A lot of times patients can be fitted for a brace and they can do rehab where they strengthen the muscles around the knee and they can get enough stability in their knee doing those things and they can avoid surgery. Ultimately, our goal is to get you back to the golf course, the ski slope, whatever it is that you enjoy.